Thousands of people in Ontario are still waiting for their results after getting tested for COVID-19. The number of cases under investigation jumped to more than 10,000 last week before finally starting to decrease. And while it appears the backlog is clearing, the province stopped disclosing the number online for the first time today. In their daily updates, the province has removed what was a critical category, the number of cases under investigation and the number of patients approved for testing to date. Up until last week, the numbers gave the public a sense of the backlog and Ontario's testing capacity.
Ontario has the most tests done of anyone. We're doing the most per day. We're all doing our best to ramp up the testing.
The numbers were beginning to show a downward trend, meaning fewer people were waiting for results. Early last week, more than 10,000 cases were under investigation. By this weekend, the number was down to just over 7,000.
It's getting better. It's getting better. I feel like we were in a trough last week.
The Canadian Society for Medical Lab Science say they're making a great deal of progress, adding staff and equipment to ramp up.
Definitely. More and more labs are coming online, and they're also piloting and validating their new methodologies. So capacity is building by the day.
A relief for families who are hopeful quicker results will help reduce the stress involved in getting tested. Ken Robinson's wife, Keelan, didn't receive her results for almost 2 weeks. They came back negative, but the wait was excruciating.
I think the biggest frustration is, when you have a family at home, is not knowing whether you can be around your family. Like for my wife, she couldn't, the kids would poke their head in the door to say goodnight, and that was about it. So it's frustrating for the person who's waiting, but it's also frustrating for everybody around them because they're tiptoeing around as well.
The province's goal is to get up to 15,000 to 20,000 tests a day by mid-April, and that will likely lead to a spike in confirmed cases.
So even if you're not hearing of cases in your community, it doesn't mean that there are no cases or that there are no exposures waiting to happen.
While COVID-19 testing is taking up the majority of their time, medical lab professionals are, of course, conducting other tests, up to 440 million a year. For City News, I'm Tina Yazdani.